Hello, and in this final video lecture, we're going to be talking about coding these perinatal conditions related to weeks of gestation and other factors that involve perinatal coding. And again, very, very critical point, and somehow some people still struggle with this. These codes from P00 through P04 are intended to describe newborns affected by maternal factors and complications of pregnancy and labor. So we can have P00.3 newborns affected by maternal circulatory and respiratory diseases. Of course, you could have a pregnancy affected by circulatory and respiratory diseases, but that would go on the mother's record. Anything that starts with a P, think newborn. You can also have a pregnancy affected by maternal nutritional disorders, P00.4. You goes on the newborn chart. Newborns affected by maternal disorders, right? So that if it's a maternal issue, disease, disorder, injury, what have you, that has to be documented in order to use these codes. PO4 codes identify newborns affected by noxious substances such as medications, tobacco, alcohol, or drugs. And the substance determines the rest of the code. So, one thing, Wade, a critical point to remember on this is in the same way we had pregnancy affected by, use the newborn affected by in the same way as a main term. Then you would look for the subterm for the specific condition. So again, critical, worth pointing out. So I'm going to put an arrow next to it. Main term, newborn, affected by. Sorry about that. My mouse is not behaving. Okay, now we're moving into disorders related to the length of gestation and fetal growth. And these are what we call the preemies. These are infants that, excuse me, are not preemies, is what I meant to say. They're full term, but they're smaller or lighter than expected for their gestational age, right? So we use that, and you can see some examples of them here. Newborn small for gestational age, right? The fifth digit will tell us how small. So you can see here, P0 5.11, less than 500 grams, 500 to 749 grams, P0 5.12. So in other words, they're small for gestational age. P07 codes address prematurity and low birth weight, or extremely low birth weight. And these codes are used later in life if the condition affects the current health status. And you can see some of them here. Extremely low birth weight, P07.01, extremely low birth weight, newborn weighing less than 500 grams, and so on. When prematurity is documented, two P07 codes are required, one for the birth weight, one for the gestational weight. And as we mentioned earlier, the birth weight would come first. Note that there's an excludes one note under P07 that excludes any codes from the P05. And the main term you'd use for this would be low for birth weight and preterm newborn for gestational age. P08 codes apply to newborns with long gestational age or high birth weight. These infants are described as large for dates or exceptionally large. So you can see some examples of them here. P08.0, exceptionally large baby, meaning over 4,500 grams. P08.1 is for babies weighing between 4,000 and 4,499 grams. And then P08.2 subcategory is titled late newborn, not heavy for gestational age. And again, here are some main terms. And again, you may want to pay very close attention to these here. Premature newborn, preterm newborn, immaturity, small for dates, light for dates, low birth weight, heavy for dates, and large baby. Conditions associated with meconium are explained here, including why aspiration is such a serious concern and how clinical scenarios lead to different codes. And meconium is the baby's first intestinal discharge, right? And the baby can pass meconium in utero. The amniotic fluid will now have meconium staining, right? Sometimes it causes aspiration into the lungs upon breathing, and that's a very serious complication. So there are distinct codes for meconium passage, aspiration with and without respiratory symptoms, meconium ileus, meconium peritonitis, and meconium staining of amniotic fluid. Now we're going to talk about respiratory and cardiovascular disorders specific to the perinatal period. This is very, very common. They fall into code categories P19 through P29. Respiratory distress syndrome produces inflamed lungs with pulmonary edema, P22.0. Infants treated with surfactant therapy and supportive oxygen, right? Because the baby obviously becomes hypoxic. And we can have neonatal aspiration, category P24, when with codes when present with or without respiratory symptoms. We can also have newborn tachycardia and bradycardia, which falls under P29. Finally, we get into infections specific to the perinatal period, falling into P35 through P39. And again, this can be the infections can be acquired in utero during birth or in the first 28 days after birth. P36, bacterial sepsis of newborn or neonatal sepsis, common in low birth weight babies, and there are unique codes that exist for this due to various organisms such as strep, group B, staph, E. coli, and others. And if the baby has severe sepsis, an additional code is used from the code subcategory R65.2. Oh, went too far ahead. Now, the last thing, live-born infants, Z38. Again, Z38 is only used once, and everything that is to the right of the period, the rest of the characters will identify the number of live-born infants and where they were born, either in the hospital or outside of the hospital. We'll identify whether they were born vaginally or through a cesarean. And the codes exist for single, twin, triplet, quadruplet, quintuplet, and other babies. And the main term is newborn, and the subterms will cover the place and number of infants. The really important thing is remember that you're only a newborn once. Transferred to another hospital with an NICU, the principal diagnosis wouldn't be the Z38, it would be whatever caused the baby to be admitted. And that's all I have for you. Thank you so much for watching. Please reach out if you have any questions about this material. Bye now.